Hi everyone. I thought we'd talk for a few minutes about injecting fillers. A lot of people have a lot of concerns about fillers if they've never had them before because they saw someone who had filler injections and they weren't done well and the person just didn't look right. And unfortunately, as with surgery or anything else, if it's not done well, the results aren't going to be good. So what are the secrets to getting really nice results with fillers? Well, I think there's three major things that we need to keep in mind, or that I keep in mind. Number one is aesthetically, what makes sense for that patient's face. This is a diagram that's a stylized diagram of some of the aesthetic proportionality that we need to keep in mind when examining someone's face. Ratios between the upper and lower lip in size, between the lower lip to chin distance relative to the distance between the eyebrows and the forehead, the distance between the corners of the eyes as compared to the width of the mouth as compared to the face. All these different proportions that we need to think about. But the bottom line is you don't want to give someone a proportionality in their face that just doesn't fit their face. If the lips are too big for the face, that doesn't work well. If the lips have changed over time and have gotten smaller, then doing a restorative procedure can be very helpful. So one issue is, what can that face use, or what would be beneficial from an aesthetic perspective? Number two, when we think about our faces, really a lot of people tell us that when I see myself in photographs, I look this way or that way. A lot of what we're doing is we are highlighting the areas of the face that reflect light so that they show up well, whether it's in person or in photos. For example, light reflection tends to occur from the middle of the forehead, from the tip of the nose, from the tip of the chin, and from the cheeks. There's shadowing or hollowing that's supposed to occur here in this area, often a bit in the temples, often a bit under the lower lip. So these are other areas to keep in mind. Where does the light reflect, so that we don't create sort of strange looking appearances where light is reflecting from places where it shouldn't, or vice versa, where we don't see the natural hollowing that we expect. And then number three is, how do we use the vast array of products that we have, and this is only just a handful of them, to get best results? These products are all a little bit different. They're made from the same basic building blocks. They're all hyaluronic acid products except Sculptra, which is a different category of product. But how are all the hyaluronic acid products a little bit different? Well, it's a little bit like saying all wine contains alcohol, but yet it tastes very different. It has to do with the manufacturing process. So understanding the different products, but even more importantly, understanding the anatomy of the face, so we know, for example, if we want to enhance projection in the cheek so that you get light reflection where you want to and you get the aesthetic balance that you want, which of these products do you use and how do you use it? So when you pull all of those factors together, aesthetic balance, understanding where you want light to reflect and what your real goals are for your final outcome, and then thirdly, how to understand and use the different products in conjunction with understanding the anatomy of the entire face and what lies beneath the skin, we can put all of that together to get very natural, normal looking results that help us look youthful as opposed to looking like we've had something done. The optimal outcome patients don't look like they've had anything done. They just look generally better.